welcome to my channel. My name is Shafiq and I'm an orthotist here based in UAE. Today I would like to discuss something about the cranial deformities in the children, in the babies, newborn babies. So we often see that the parents notice that some babies which are born, they have some abnormal head shape. So there are two types. One is a congenital type of head deformity, the other one is acquired. So basically what happens that we noticed there are three main types of the deformities which the parents noticed or we noticed. So one of them, if you see there, if suppose this is a head, mostly we will see the posterior, the occipital area of the skull. It is more flatter than the front or the sides of the head. In that cases, the medial lateral distance or the dimension of the head is wider as compared to the anterior posterior. The medial lateral dimension is more in such patients. The second type we often and we noticed more common, which is known as Plagiocephaly. In Plagiocephaly, it's also asymmetrical appearances of the shape. If we divide the head into four proportions, if we divide the head from here, anterior, medial lateral, anterior posterior, if we divide this into four equal halves, so the one of the quadrant of the head will be more flat, and the flatness on the same quadrant, the interior part of that head will be it will be in bossing position. It will be more round, more interior, more forward progressed. So in case if I will show you another model that the back side of the head is flat, it can be on the right side, it can be on the left side. With the combination of the interior, there is a possibility that there is only the one quadrant posterior side is affected, and that there is no any problem with the forehead shape. But there is also chances that the forehead is very pronounced on one side than the other. It can be the same side, the one we have flattening on the back. In case if we have flattening in this patient on the right side, right flattening, so it means it will be more bossed here on the same side, on the right side, and the left interior will be more flat. So this is called Plagiocephaly. So with this asymmetrical appearance, we have also noticed some other things. In severe cases, there are chances of the shift of the ear, the interior shift of the ear to the side which is more flat on the posterior, so that ear will be anteriorly shift. If the interior shifting of the ear as compared to the left, if it is more than 6 mm, we compare this as abnormal ear shift. Similarly, we have a combination of deformity, asymmetrical plagiocephaly. In that, there is chances that there is a flattening of the one side of the head along with the medial lateral dimension is more. It is like compared with it's a combination of brachycephaly and plagiocephaly. So in that one we will observe a head which is more wider and more asymmetrical at the same time. So these are the general appearances. Kindly have a look on some pictures on the screen. The third form of the head, which is called Scaphocephaly. So in that form of head, if you will see, the anterior posterior dimension is long. This is a type of head which is long enough from anterior to posterior. and the sides of the parietal areas of the skull, it is more flattened. So you will see a shape of a long head. So there is also chances, very less chances, that there is some ear alignment problem or some cheek alignment problems. So these are three most common types of the head deformities or cranial problems. In addition with these, there are some other problems. For example, if a baby is born with the hydrocephalus head, the doctor will do some operation. They will put some inside some shunt. So if you can see here in this case, for example, this was one of my patient, and he has shunt here on this area. So you will see a prominent marking here. So if the patient is some different kind of medical condition, then we need to deal accordingly. The fourth form of the head problem for the cranial remolding, orthosis or the helmets, that will be a case, post-operative case after craniosynostosis. If the patient is diagnosed with the craniosynostosis, the doctor, the surgeon, the neurosurgeon will go for surgery. He will release the joints, the sutures, and after that we need to we need some cranial remolding orthosis to shape him accordingly as per the requirement. So in that cases we have to use that helmet as a protective and as a corrective measure. How we will deal this? Once the patient is with a pediatrician or any doctor, he will refer patient to orthotist. If he has enough awareness about the field that we have something, we can call it cranial remolding orthosis, and we can reshape really the skull. Okay, what are our steps? First of all, when the patient will come to us, we have to see it, we have to diagnose it. If this is a positional plagiocephaly, if this is a positional brachycephaly, if this is a positional scaphocephaly. In that cases, we need to see many things. First of all, this patient should have free from the craniosynostosis. That can be diagnosed by MRI by doctor. If you have any, if you are not clear about that, much better that will refer the patient back to the treating physician. So he will do MRI and he will confirm that this is not a case of craniosynostosis. Once the patient is here, we have many things to do stepwise. What we have to do, we need to see first the age of the patient, if he was premature or he has some severity, it's really more, or we see that what is the age. So before starting a cranial remolding orthosis, we have to first do repositioning. So for repositioning, we need to place a baby in such position that the flat area of the head should not take the weight of the body. And usually patients with the plagiocephaly, they have also sometimes a condition of muscular imbalance, torticollis. If the patient has torticollis, so definitely it will affect the shape of the head. In the case of torticollis, we must do a physiotherapy first before starting a cranial remolding orthosis. Or we have to start this, at least both things at the same time. Physiotherapy is also must. So when the muscles, which is strong muscles, which is in the neck, if you release the things, the weak and the strong, the imbalance, when it will finish, it will automatically give some sort of correction. So there is one misunderstanding by the doctors that this remolding, the deformities of cranial remolding or the skull problems, it will resolve by itself, no need to do anything. This is totally wrong and it is against the research. We have seen many patients who have misguided by the doctors who doesn't know really about the cranial remolding orthosis. And once the patient is already 1 year, 1.5 year, then there is no any chance to correct the skull, correct the head shape by a cranial remolding orthosis. In that cases, the surgery will be the last option. We will not have any conservative treatment. What will be our next step? First of all, we have to see the thing that the patient is free of craniosynostosis. We will guide the parents to do a repositioning at home at least until age of 4 months, and we'll do a follow-up and we will see if what is the condition of the skull now. We guide the parents not to put the baby on the flat area. For example, in this case, if the baby head is flat here, so he will love to sleep on that side. We need to encourage the parents to take off the load from that area. There are some pillows which will help a little bit, but we have to reposition the whole body that it will be, we remove the weight from that area, it will go on the area which is coming out, which is bossing area. This is the first thing. We will see some kind of improvement in that cases. If even after 4 months there is no any chances of improvement, if we saw that there is a severity which is really it's moderate or it's severe, then we need to decide with the parents whether we should go for the cranial remolding orthosis or not. Once we decided that we will go cranial remolding orthosis, we will do a 3D scan. We need to put some stuff there on the baby head and we have to capture this. It's a totally computerized generated reports and the shape of the skull, whatever we have there. Once we got the scanning, after that we do a modification and we make a full customized cranial remolding orthosis. How we do, for example, in case of this area, if this area is flat, we have to make space here so that the head will grow on the right direction, and we stop the growth on the area which is coming out. We need to stop that one and we encourage the area which is flat and which needs to grow. Basically what happens, the brain, it is just imagine like it's a balloon full of water. So once you press the balloon, so it will go everywhere, or if you put more water inside, it will go in every direction. So same, when the baby skull is growing, the brain is growing inside, so there is equal growth everywhere. So that is the right time we need to guide that growth. If the baby will stay lying on one position, and there is chances that there are a lot of pressure forces by the head, by the ground reaction forces, and the skull bones are very soft and moldable. So at that time, whatever the position you like, it will be gained very easily. So in cranial remolding, we do the same principle. We make the spaces on the area which is really flat and we need to grow there. We need to close the area, we need to stop the growth which is unwanted. At the same time, if you observe some patients who have really cranial vault, a very prominent head shape, it's very prominent from here, it goes like a bridge down. We need to cover that area also. So what happens when the growth of the head will in the right position, so this will automatically come down. Once we have done this one, it will take some time for fabrication. Once the fabrication is done, then we will do a fitting. This is the cranial remolding orthosis. It is made from the plastic, and inside there is a very medicated foam, very soft inside. So there are some points for this one. When we are here for fitting, we need to trim it, we need to cut it, we need to grind whatever it is required as per the need and as per the deformity. And now the actual challenge started from day first. So day first we will encourage the patients to use 1 hour on, 1 hour off, 1 hour on, 1 hour off, and no nap, no sleep. Second day we encourage to use 2 hours on, 1 hour off. Third day we increase 4 hours on, 1 hour off. Day 5 we encourage them to use at maximum time at least 22 to 23 hours and full time sleep. And at daytime they can remove it for at least 15 minutes, 15 to 20 minutes after every 3 hours of time. This journey is little bit long. It's like it can take from 3 months to 4 months, even 5 months. In post-surgical cases, even 6 months to 9 months. And in some cases, we need to remake this at least twice. So the outcome, the results are amazing. If you see a baby here with the flat head, even in worst cases, you will see the cheek alignment is also not symmetrical. One cheek is forward, one is back. The eye alignment is also disturbed. The ear is disturbed. It's totally, if it's a frontal involvement of the face and all the cheekbones and everything, so it's really visible and everybody will notice. For the sake of that one, we need a correct time to do cranial remolding program. We have successful rate like 90%. We can get the improvement. In mild cases, even 100%. And this depends now how the parents will use this cranial remolding orthosis. Once we fitted it, we tell them to come back after 1 week for follow-up appointments. So in that one, we see if there is further adjustment required. There is a lot of problems at the beginning. It will be loose. There will be a lot of movements. We need to look everything. After 1 week, then every 2 weeks there is appointment. In every 2 weeks time, we do a cranial scan. We compare the head and we can see the visible growth by computer generated reports. In the system, we can see that this much growth has happened on the right direction. So in some cases, if it is really tight little bit after 2-3 months due to overgrowth of the baby, so we need to adjust from inside, because this one is very thick, 10 millimeter, 12 millimeter thickness. So we have enough area to modify it. Once the modification is done, it can be a journey of 3 months, 4 months. We have to check up 2 weeks, then after maybe 3 weeks, in some cases even after 1 month. Once we finish this our treatment, once we got our a very nice rounded skull and shape. If any query regarding the cranial remolding orthosis, kindly comment below. I would love to answer it. And if you know someone who has problem with the cranial remolding, kindly contact with their orthotist and fix the head deformity. If you like my video, kindly subscribe my channel, and if you have any comment, kindly write down, and see you soon in another video. Thank you. Bye bye.